Do you think testing once a week is enough and for the season? I mean, do you if the capacity allowed it, would you be testing more than once per week? What is kind of the feeling to try to, because you can't put the kids in a bubble because they're not in one dorm and things like that. What do you think is appropriate here, based on capacity?
Yeah, I mean, that's a good question. I think, a lot has to be evolving with all these testing. I think right now, I think it's certainly a reasonable minimum standard to do and uphold to. I think, preseason and out of season, we're testing more than what the ACC is recommending right now. And I think that's appropriate as well. And so, obviously, I think the testing is a piece of this. It's not 100%. No test is 100%. So it helps give us some guidance. And it helps, some of the student athletes look forward to something else that's coming up to kind of reinforce the behavior that we're kind of educating them on, right? So they need to be doing all the things outside of the facilities. Inside the facilities, it's easy because we got a lot of reminders. We got staff to say, hey, keep your masks on and wipe your hands and do those kind of things. But when they leave the facilities, that's where opportunities for them to kind of go a little bit off can happen. So I think our education piece has been strong and hopefully they're doing all the stuff that they can do on the outside, and the testing just reinforces that.
And are you asking them to self-report if they leave campus and let you guys know?
If they leave campus, like to apartments or things, or?
No, like outside, like visit family at home or take a trip somewhere. I mean, how are you handling that? And what are the protocols to try to make sure nothing happens if they do leave?
Yeah, so part of the education piece is trying to minimize any kind of travel, certainly to higher risk COVID areas, which several of our student athletes are from. And so I think the education piece is big on that. And obviously then communication with the team, whether it's to the director of ops or all of us, to kind of figure out where they're going and when they're coming back. So we try to minimize that as much as we can. But, at some point too, if they need to get home and see their families, we want to support that in a safe manner.
Mike Barber, you're up.
Doc, thanks for your time doing this. To follow up on that topic, if players go home or if they go somewhere else, are they automatically tested, or it's only if they show signs? Does it wait the week? How do you handle that if they've left?
Yeah, so I think part of the concentrated surveillance would be involved in that. So if we know someone went to a higher risk area, they would potentially be in that concentrated surveillance week that week. If they go, obviously we want them to be safe when they're gone. And so we wouldn't automatically test them when they get back. There's obviously some lag on the testing capabilities to show up. So if you go to Myrtle Beach this weekend and I test you tomorrow, it's not going to show up. So we need some time on that. So I think that's where the precautions and the concentrated surveillance will come. And obviously once we get in season, there will be a lot less travel. So that's why I think some of those education pieces is huge right now.
Obviously, there was a specific claim that the players had gone to Myrtle Beach, and we know that is a hot spot. Are you aware of players going there, and was that a concern for you?
I don't know off the top of my head on who was there. I know there's a report on that. Certainly for a time period there was Myrtle Beach was definitely a hot spot, especially North Myrtle Beach. So I think we're following those kind of hot areas. There's a lot of websites from Hopkins and a global websites that look at new cases and surveillance. So we're following those to kind of see where those places are. We're also looking at those, as we have games coming up, what do those hotspots look like for other ACC places? So as we're looking to travel to some of those places with the team, how does that impact our decision-making and stuff like that? So I think there's a lot of good work going on behind the scenes to kind of try to mitigate that stuff. And I think a lot of that stuff comes back to our education piece and having them do the right things when they leave campus.
If I could sneak in real quick, one more. In your professional opinion, do FERPA laws prevent Virginia Tech or any school from saying we've done this number of tests and this number come back positive, or is it only about specific individual information?
That's not a question for me. I think that's more a legal question for FERPA stuff. So I defer that to the lawyers in campus.
Thank you.
Sure.
David Teal.
Thank you, Dr. Rodgers. We've heard stories around the country about the testing infrastructure. What have you found about the supply of tests? Have you found you have enough? And especially as you test more during the season, are you confident you've had enough? And what is the turnaround time for testing?
Yeah, that's a great question. I mean, obviously there's been shortages across the country. Knock on wood, we've been fortunate with getting supplies. And I think part of that is great support from our partners from the health department and Schifferett Health Center. So we've had enough supplies to do the appropriate testing that we've done so far. I know we've got plenty of testing, kind of looking forward to this season in anticipation of everyone being able to go full. We're planning on testing all those appropriate parties. And at least at this point, we have plenty of supplies to be able to do that. I think Fralin Labs and the health department and Schifferett have been great partners in that. Our turnaround times been certainly less than 72 hours in general, and sometimes even close to 24 hours. So I think they've done a great job to help us guide that stuff and help us process through that.
And has that partnership, Dr. Rodgers, helped you mitigate the cost of testing?
It certainly can help. I mean, obviously we're still paying for supplies and doing that kind of stuff, but it certainly can help to have some of those connections.
Thank you.
Chris Coleman, are you out there?
Yeah. Mark, is there a hard number for how many student athletes have to test positive before a sport or sports goes into quarantine?
Yeah, that's a good question. I don't have a hard number. I don't think that anybody can put a hard number on that. I think, one of the things we've talked about the ACC level is, some of those things. So what does it look like in the area? How can hospitals, what's their capacity to handle sick patients? So some of those mitigating factors. Obviously, if you have a significant percentage of the team that can't participate, then that's going to eliminate some of those things. So I don't think that I can put a hard number on any of those things.
Norm Wood.
Hey, Dr. Rodgers, thanks for doing this. Couple things. Kind of walk me through what happens if a player does test positive, and I'm talking about that from a team standpoint, specifically with the football team. Does the thing shut down temporarily, and you have to do a certain level of testing to figure out if anybody else is infected? How is this? What's the protocol?
Yes, sir. So all those treatment protocols really are coming through the health department. So if we get a test back, we'll get communication from the health department on that test. Then we'll get in touch with those student athletes. The health department communicates with them, and we'll contact trace to see who else would be close contacts. And then we make kind of decisions from there. So regardless if it was a football player or a soccer player or cross country or whoever it is, we take guidance kind of who needs to be in isolation, who needs to be quarantined from the health department. And then we kind of enact that. And then obviously while they're in those positions, trying to support them as much as we can through mental health, through nutrition, through whatever we need to do if they're in isolation.
And understanding that this is sort of a ever evolving animal here, and you'll go by what the CDC says. If things remain as they are now, which is asking a lot between now and next month, what could you reasonably envision as being an appropriate number of fans or percentage of fans in that stadium? Could fans attend games at all, in your opinion, safely?
Yeah, that's a good question. I don't know that I have a great answer for that. I think there's a lot of factors to that. And I think there's a lot of people working on that. We've certainly had some discussions at the ACC level of that with no firm conclusions yet. So I think there's a lot of things that are going into that, a lot of smart people, smarter than me, that are working on that stuff. So I would imagine we'd have some answers here closely. Hopefully we can start playing here pretty soon.
Thanks.
Yes, sir.
Travis Wells, I see your hand.
Hey, Dr. Rodgers, I'm just curious what you've learned from being a part of this ACC medical team and medical board. Is there anything, first of all, how often do you guys talk or meet virtually? And is there anything that you've taken from any of those folks that you guys have been able to implement, or maybe even vice versa, that you've offered to them that you felt like something was a good idea that could work?
Yeah, I think it's been a great group. Obviously, we've been meeting regularly. They came up with the document that you guys have all seen. So I think it's been a great collaborative effort on all that kind of stuff from people from all different areas. Obviously, some are hot spots, and fortunately in this area, we haven't had as many cases as elsewhere. So it's been a good collaboration and getting a good prognosis kind of going forward, at least having good insight into all across the ACC and producing some documents that hopefully guide some decisions.
Eric Johnson, you're next.
Hey, Dr. Rodgers, appreciate your time here. You touched on the educational piece for the players moving forward. I'm just curious, have there been any strict guidelines, anything on paper for them to kind of go home with and take away with them when they're away from the facilities in terms of, keeping safe and making sure everybody, when they do come back together, is safe as well?
Yeah, so we've had a couple different pieces from the education. Certainly, we've had some videos go out. We've had some, face-to-face or through Zoom kind of stuff rather. There's been some reminders around different kind of things as big weekends are coming up. Our education team has kind of put some reminders out about wearing face masks and physically distancing and washing hands. So it's kind of a consistent message really that they've had since they've come on campus. For all the sports really, and a lot of that even begins before campus. So campus right now is obviously pushing a 14-day quarantine before students come back. Certainly we comply with that stuff and agree with that and get that message out to all of our student athletes as well, even though some of our student athletes are coming back ahead of the general population.
Mark Berman.
Good afternoon. As a man of medicine, how comfortable are you or not with the idea of playing football this fall? I mean, does the idea make you cringe inside, or do you kind of think this is a good idea?
I think that's a good question. I think, things have been a moving target really since COVID started several months ago in this area. So I don't have a great answer, but I think that we're doing as much as we can to keep it as safe as we can and operating under the assumption that our student athletes want to perform. And so I think it's our job as sports medicine team to make it as safe as we can so that they can perform. I think certainly, like we've talked, not only in the sport field, but obviously outside of the sport field, there's risks for COVID. So I think we just need to be smart and take as many precautions as we can and leave it to the experts to kind of move forward.
Mike Nizilik, I see you have a follow-up.
I had two. Did you guys, when you put together or kind of spearheaded the effort to put these guidelines together, did you guys seek out input from student athletes? Was there a mechanism to be able to do that? How much say or how much involvement do they get to kind of have their concerns heard or have their sort of input on the procedures you outlined? And then when you're done, I have one more.
Yeah, so I think we're always open to hearing concerns. I mean, I think there's been just more questions probably than concerns that we fielded, not only from student athletes but from parents. And so I think having that open dialogue is key in their decision making to voluntarily come back and do sports, or even to voluntarily come back and do school. So I think we've been open for a lot of that kind of stuff. A lot of the guidelines and protocols we're using are really going off of CDC and NCAA and ACC. So most of those input really haven't had student athlete input. Most of that stuff's been from various committees and health organizations.
This might be in process, but I haven't heard from many teams about this. How are you going to go about traveling to games? Those are confined spaces. Schools right now are limiting bus capacity. Is there a plan in place, and are you guys going to try to limit hotel rooms in home games or even on the road to try to travel same day?
Yeah, I think that's ongoing discussions really to kind of see what the best way, what the best approach of that is. I think lots of things go into that factor. I don't think we've got anything hard and fast permanent right now. There's too many things that are changing between now and potential games. And so I think the CDC, our committee has been in touch with the CDC and looking at guidelines from them, and then coming down from the ACC, kind of down at least to give us some general stuff. And then if we're comfortable with that, which most of the time we pretty are, then great, we can move forward. If we want to add additional stuff, we can do that. So a lot of those discussions are still ongoing.
Andy.
Yeah, it seems like sports that have a bubble right now are doing pretty well, and those that don't are having some struggles. College football's not in a bubble right now, but you guys are pretty isolated on campus as it is. In a couple of weeks, 20, 30,000 students will be coming back. How concerning is that to you? And how, it's probably going to be an inevitability that football players will intermingle with other students. How do you get ahead of that, or what are your concerns with that?
Yeah, I think the biggest concern is just the population, right? And coming back in. I think Virginia Tech campus has a good plan of kind of getting people back to classes and mitigating risk. And, hopefully all of our student athletes have had enough education over the last little bit that when they're in some of those common areas or classrooms or whatever, they're maintaining their mask and social distancing, washing their hands when they're going in and out. And so I think if those precautions are followed, I think that's a pretty reasonable thing. And I think we'll be at least heading on the right path.
Is that a reasonable expectation to expect college students to maybe not act like college students sometimes? I think you look at like Rutgers, I think Louisville today, they trace a lot of this stuff to off-campus parties or things like that. It seems like very college student things to do.
Yeah, I've certainly read some of those reports, and I think that's certainly part of college life for a lot of us, and it doesn't have to be, right? So I think it's a physical choice that they're just going to have to make. And if they're conscientious about, their goals, and obviously you want to go to class, and if they're here to play sport, then I think those two are the two most priorities to keep themselves safe and keep the community safe. So I think that's going to have to be a priority of the student athletes on what their focus is going to be.
Wes McElroy.
Dr. Rodgers, thanks for doing this. Just a quick question on the guidelines of, if you've heard the guidelines or what the mandatory guidelines are from the NCAA, if a player would test positive during the season, I know there's been some things about 10-day quarantine. If someone's been in contact, a mandatory 14-day quarantine. What are the guidelines if a player would test positive in the season?
Yeah, I think those guidelines would hold whether you're in season or out of season. So if we have a positive case, you go into isolation for essentially a 10+1 rule. So minimum of 10 days, assuming their symptoms are resolving, and 1 day of no fever off medicines that would lower a fever. So that would be the same in season, out of season, or whatever. And certainly close contacts, which will be identified in our case by the health department when they do their contact tracing, those would go in quarantine for 14 days. The reason for that is really because if they develop symptoms, we want to make sure that we can limit that exposure. So quarantine versus isolation. Isolation is positive cases. Quarantine is for close contacts.
Mike Barber.
Doctor, I wanted to follow up. You guys have pointed out a number of times that the Beamer barn, the indoor facility, is being used as open air with those big garage doors open. I wanted to ask you kind of how you define kind of inside versus outside, and how you feel about the safety of that facility for large group workouts.
Yeah, I think we didn't come to that decision alone. Obviously, we had a lot of consulting. We had the health department in, we had campus looking at it. We had a lot of people involved in that decision. I think that facility is phenomenal for a number of reasons. But number one, obviously, you can raise all those garage doors. You got great open airflow through there. And so it's functionally considered an outdoor space with all those things open, which has been great. So, I think having that with the outdoor field right there, we really have two functional outdoor spaces, so we can spread things out, some physical distancing when we can, and doing a lot of those things. So I think it's safer that way. Absolutely.
And many of our readers have not had a COVID test. Would you mind telling us exactly what an athlete kind of goes through when you test them for the virus?
Yes, sir. So I've had them myself too. Obviously, we're getting tested. So I don't know if you guys have, but right now we're using nasal pharyngeal swabs, which just means it's a really long Q-tip, and we go through the nose back to the posterior oropharynx, so back in the back of the throat. So it's not a comfortable test. Makes your eyes water a little bit, but it's at least a good sample. And so that's what kind of we're going through right now. Hopefully there'll be more tests as things evolve, and maybe we don't have to do nasopharyngeal tests weekly on all of us. I would appreciate that certainly, but right now that's the best choice, and certainly doing PCR tests is the best recommendation. So that's what we're going to do right now.
We've got time for a couple more. David Teal.
Dr. Rodgers, kind of following up on the concerns you voiced about the general student body returning to campus, are you encouraging athletes to take online courses whenever possible to minimize exposure?
I don't think necessarily that's my role in all this stuff. I think really if they would have that option, which any student does, they can certainly do that. I think there's a lot of factors in that. I think academic support would help make that decision with them. I know for me, I was always learning better if I was in person. So, if I was in this role right now, I would certainly try to go in class and do safe things. I was pre all this online classes. So fortunately I never had to take an online class, but for me, I think it's multiple factors in that. And I'm not sure, that I'm the one to be advising them on that stuff, but.
I went to college before the internet, don't worry.
Mark Berman, you have a follow-up.
Yes, thank you. Based on the testing so far that you've been doing, are you optimistic, or what's kind of what's been your thoughts as you've seen the testing results come back?
Yeah, I mean, I think we've done a lot of testing, the surveillance testing, the screening, and I think, it's done a good job. I think I'm optimistic, and again, kind of, operating under the opinion that our student athletes want to compete, and so we're going to try to do everything we can to keep it safe and keep this thing rolling if we can.
Travis Wells, you have a follow-up.
Hey, Dr. Rodgers, I know some different companies have developed these face shields for helmets and so forth. I think Shutt has one. And if I'm not mistaken, one of the kids, it may have been Jesse Hansen, put one on his social media this week. Is that something that all the guys are using? Is that just an optional thing? Can you speak to that?
Yeah, absolutely. I think that's been a great collaboration for us. We've been working with Virginia Tech Engineering for over a month right now, working on trying to customize some of those face shields for helmets. And so I think certainly it's a reasonable thing to consider. At this point, we're not going to make it mandatory. I'd like some kids to have some input on that. Obviously, it's their helmet. They're doing what they want to do. But right now, we've been doing some aerosolization and some impact testing to make sure how much can we limit the spread on that, making sure that the helmet's still safe and it doesn't alter that. So I think it's a great opportunity to kind of partner here with engineering and get something in place that hopefully will help limit exposure and spread, specifically with football.
Last one, Mike Nizelik.
Can you say how many tests you've administered, COVID tests overall so far this summer?
No, I don't know. I don't know an exact number off the top of my head. So.
And you guys you still aren't going to discuss positive cases at all?
That's correct. I think we're deferring that really to a campus decision. So I know Dr. Sands and Witt have been communicating about that. So I'll defer that stuff to them.
All right. Thank you, Dr. Rodgers. Appreciate your time. We'll let you get back to your day job.
Thanks, guys.